The wound care industry is a over $50 billion cost out of the healthcare system. The solution that's out there today is a lot of just doctors having to use their gut to figure out what's going on. Ralph, you've created a company called MolecuLight, and you've developed an imaging and scanning technology that highlights a wound and bacteria that's in a wound to help improve the treatment process, and you're talking about a cost savings to the system of up to 89%. How do you achieve that cost savings?
Patients who present with chronic wounds, these are wounds that often don't heal for years sometimes. Over the course of that time, you've got a number of clinical processes that have to happen, both on the diagnostic side, but as well as on the treatment side. And often these patients are taking up beds in hospitals and taking up unnecessarily time with doctors and nurses. So if you amortize all those costs, they're staggering. What MolecuLight's technology does is it offers a clinician, whether you're a doctor or a nurse that sees these patients on a regular basis, it gives you a chance to identify those patients who can benefit from more rapid care, right? So we have our technology, the MolecuLight iX, which is now launched all over the world, which allows the doctor at the point of care in real time to identify those wounds that have a very heavy amount of bacteria. Remember, bacteria are invisible to the naked eye. You need a microscope to see them in a laboratory. But in the real world clinical setting, it's a real challenge.
And doctors can't just from their education and training and experience really identify where all the bacteria are hiding?
It's highly subjective. Do you feel pain? Is there warmth around the area of the wound? Is there redness? So these are very subjective measures. And as you can appreciate, doing this day in and day out, it can be quite a challenge to make a definitive diagnosis. So we take the guesswork out of wound assessment. Our technology shows you in an instant, just using light-based technologies. It's a phenomenon known as fluorescence imaging that we've put in a small, compact, completely portable technology. It'll take a regular white light photograph. You'll dim the lights, and then you'll take a fluorescence image so that you don't need any contrast agents. You just have to dim the lights. And if you can't dim the lights, for example, if the lighting in the studio was prohibitive, we've actually made a disposable, one-time disposable that clips on and sort of makes a little light tent.
You're rolling that out on a commercial basis now with FDA approval, but you've got a roadmap for additional scanning technology. So what's next?
It turns out that if you take our camera and slightly modify it in terms of the shape of the camera, you can actually make it into more of an endoscopic probe. And so we've done that. We've just finished phase 2 studies in breast cancer patients. So we've teamed our device with a special contrast agent that has already been approved in the US for other applications in glioma surgery, fluorescence surgery. And so our cancer business is now taking off, and we're about to start a phase 3 trial. It's extremely exciting. And in the breast cancer case, this would be the direct application would be in margin assessment. 1 out of 4 women have to come back for another operation because the microscopic disease is invisible to the naked eye. With our technology, the patient would drink this imaging contrast agent, which is very safe. And in the operating room, they dim the lights and then turn on our camera, and there it is. The tumors look red, the rest of the tissue looks green, and you can see smaller than 1 millimeter tumors, which is turning surgeons' heads inside out. Like, they're super excited about it.